afternoon, everybody. I want to talk this afternoon about the situation with the Haitian immigrants in the city of Springfield, Ohio. I know there's been a lot of talk and discussion, particularly over the last few days. I want to set out what the essential facts are. Springfield, Ohio is a community of approximately 58,000 people. Over the last several years, this city has received immigrants somewhere in the neighborhood of 15,000 new immigrants, new residents. I don't think anyone's sure of the exact number. That obviously represents a massive increase based upon percentage of the population in Springfield. It is unprecedented in such a short period of time. This afternoon, I first want to talk about the challenges that this surge has created for the people of Springfield. Second, I will discuss what we're currently doing from the state level to be of assistance to the community. Third, I will explain the further actions that I'm ordering today. And fourth, I want to talk about what the federal government is not doing and what I believe is an obligation on their part to be part of the solution and to be of help. First, let me talk about the very real problems that the community is dealing with every single day. Springfield's hospital and healthcare systems have seen a dramatic influx of new patients, increasing the need not only for healthcare, but also for translation services. Let me talk for a moment about that healthcare situation. And to put it in perspective, these are immigrants who come from Haiti, which is a country that has very little health care. The health care that Haiti had, which was not much, many of the doctors have left since the assassination of the president a few years ago, several years ago. So it is much worse today than it has been in the past, and it's never been good. What that means is that we have potentially 15,000 people. We do have 15,000 people or so in Springfield who really have not had health care. And if they've had health care, it hasn't been very much throughout their life. What that also means is that the number of these individuals, we don't know, but the number of these individuals who are not vaccinated from things that we take for granted in this country is a high number and very, very significant. These facts have a great potential for community health challenges as well as individual health challenges. I talked to Dr. Vanderhoff at length about that. So that is one of the big problems. Second, we've seen a dramatic increase in the migrant children in Springfield schools, resulting in an increased need for more English as a second language services in these schools. Let me talk about the safety on the roads. Again, there aren't that many cars in Haiti. Most people don't drive. So a good number of the individuals who come to the United States have not driven before. And they certainly do not have an Ohio license, but they have not driven, many of them. And those who have driven, have not gone through really any formal courses. This has created a great deal of concern among people who are on the road in Springfield and in Clark County. There's really not a familiarity also with the laws of the United States. This, again, creates a very significant problem for the Springfield community. Next is the housing problem. We are seeing people who are bunched together in homes. One of the other results that we have seen is that the cost of rent is up. Supply and demand, it means it's up for everyone. So you can have someone who has been renting in Springfield for many years and who has to deal with that high rent. Let me talk for a moment about what we are doing and have been doing. In addressing these considerable challenges, we've been consulting really for a number of months, many months, with Mayor Rue, with the county commissioners, with the health director, school officials, the superintendent, other individuals. We've had meetings at the governor's residence where we pulled people together from Clark County to discuss the problems. So just in a nutshell, as a result, we've conducted driver education classes. We've provided driving simulators. We've taken other actions through the BMV to try to help train these Haitian drivers. Next, in regard to health care, as you know, a few weeks ago, we announced a new health clinic in the Springfield City Schools to dramatically expand primary care access. We have also increased support and provided help for more vaccinations and health screenings through the local health department. Local health department is conducting additional clinics, I believe 2 days a week. We've been supportive of those. But we also know, and I'll talk about this in a minute, that those have to increase as well. We've provided additional funds to the local county job and family service departments to provide translation services. We've tripled funding to Clark State College for services to teach English to Haitians at Clark State. And we're working with Springfield Superintendent Hill and his team to help them maximize existing resources and provide ongoing support to deal with the surge of migrant students. Now, let me talk about what I'm announcing today and what else we will be doing. And this will not be the end of what we're doing, because this is an ongoing situation. First, I've directed the Ohio State Highway Patrol through Colonel Charles Jones, who is here with me today, to surge troopers and patrol cars into Springfield to help the local Springfield Police Department deal with traffic concerns in the community. The goal, of course, is to reduce dangerous driving regardless of who the driver is. We've consulted with Chief of Police Elliott on that, and this action by the Ohio State Highway Patrol will begin tomorrow morning. Next, while we've already, as I said, made substantial investments in the healthcare community in Clark County, we know more must be done. So I have directed Dr. Bruce Vanderhoff, Director of the Ohio Department of Health, to work with the Clark County Health Department and other health care providers to dramatically expand access to primary care. I am committing today a minimum, and I've instructed Dr. Vanderhoff this, a minimum of $2.5 million over the next 2 years to deal with the surge that we are seeing and the great demand for primary care. It has an impact, obviously, on the Haitians who are seeking the primary care. It also, because of that dramatic increase in surge of demand, we are seeing longer wait periods of time, significant wait periods of time for other residents who have been there a long period of time. Let me talk now about the federal government's inaction in this area. It's the federal government's policies that have created these surges. We are also, in addition to Springfield, seeing surges, not as great extent yet, but we're seeing surges in Findlay and in Lima. And I'm sure there are other cities that are seeing surges across this country. When we see surges like this, surges that no community can anticipate at all, no community can be prepared for. No community can expect such surges as this. We will naturally see all the consequences that I have described in Springfield. And so when these will happen in other communities, we will see these things happen again and again. The federal government simply has to be part of the solution. They have to step up. It is their policies that have created these surges. The federal government needs to assist these communities with real dollars. These dramatic surges impact every citizen in the community, every citizen. The moms who have to wait hours in a waiting room with a sick child, everyone who drives on the streets, and it affects children who go to school in more crowded classrooms. It has so many other impacts on that community. And so the federal government, without a plan for this, and without putting in the resources, really, I think, owes it to the citizens of Springfield and the other communities that are involved. The federal government does not have a plan to give any support to the communities impacted by the surge, and we have absolutely no indication that a plan is coming in the future. Now, let me talk for a moment about the big picture. And I want to be very clear. 16 countries, including Haiti, I believe we counted, come under the category, citizens can come under the category of temporary protected status. Temporary protected status. That is what Haitians who are here. We have a long history in this country, throughout most of my life, maybe before, of when we see a situation in a country that is dire, and we see people flee from that country, or wanting to flee from that country, we have created special programs, special policies. When I was in junior high and then in high school, it wasn't the same program, but we had a policy in regard to people coming from Cuba. We have, as I said, now have, in addition to Haiti, we have 15 other countries. So I want to be very clear, I am not against this program. I'm not against this program. What I do say, though, is that with this program, there has to be a plan. And there has to be a plan to prevent situations like we're seeing in Springfield. But if, in fact, they do occur, we clearly need help from the federal government. Haitians who are here are hardworking people. They have families, and they care about their families, and they care about their children. They came to Springfield, Ohio, for work. And many of them are working and filling positions in Springfield. They left a country that is abysmally poor, but that has seen a much worsening of the situation since the assassination of the president of Haiti in 2021. Since that time, we have seen violence at an extremely high level, a dysfunctioning government, a dysfunctioning police, a country that is by and large controlled by very violent gangs. So it is no wonder that these individuals left Haiti and are here in the United States. So I do not object to the temporary protected status program. I do object to the fact that there's really no plan that has been put forward for the settlement of these individuals. You see that we have in this country traditionally, when we have refugees, different category, a plan for the settlement of these individuals, and it's done in a generally an orderly way. That was not done here for some reason. In closing, I want to thank the people of Clark County and Springfield. They have been very humane about this. They have been trying to deal with a difficult situation and dealing with it in a good way. So many officials, churches, officials at our schools, so many others, they have truly stepped up. And they have done what was the right thing to do and tried to deal with this situation so that the people of the community would be protected, but at the same time, the new members of the community would also be taken care of as well. The things that I have announced today are the latest in the things that we are doing. We will continue to work with the officials with the mayor, Mayor Rue, county commissioners, and others to continue to try to work with them and do what we can. I'm happy to take any questions.
Obviously, Springfield is in the headlines and grabbing national attention for claims that Haitian immigrants are eating other people's pets. Do you denounce other Ohio Republicans who are elevating those claims despite...
Look, I came here today because I thought it was important to outline for the people not only of Springfield, but of Ohio and the country what the essential facts are. The essential facts I have gone over are, to the best of my knowledge, the essential facts. As far as other things that might be occurring in the community, I would refer to local officials who have spoken out and who have talked about what they are seeing. I do not live in Springfield. I live close, but I don't live in Springfield. And so, I think you should refer to the mayor. I think you should look at the city manager, I know, issued a statement. And I would call your attention to those statements about any of these particular matters. My job is to talk about what I know and to talk about the essential facts. And I think what I've outlined today are, in a condensed version, the essential facts.
Kind of piggybacking off that question, do you see this as, or I guess how some people can see this as kind of political theater in an election season, that you would have a press conference talk about this? This would be at the top of your agenda right now.
Well, we've spent a lot of time on it, so it's not something that, we just woke up yesterday and decided to get involved in. This is, a very unprecedented situation in Springfield. We've been involved for some time. We wish we had some help from the federal government, but we're going to continue to move ahead and try to work with, and will work with, the local officials, again, to try to deal with the situation. That's what everybody is trying to do. Deal with it in a humane way, deal with it in a correct way, understanding that everybody involved, these are individuals, and that the people of Springfield have legitimate concerns. But I think they, as I said, they've handled this, I think, in a very, very good way. So I'm trying to stay focused on the issue at hand.
We're all, of course, aware of the bus accident in Clark County.
I'm sorry, I didn't hear the first part.
Obviously, we're all aware of the bus accident that occurred in Clark County.
Yeah.
Beyond that, have there been an uptick in accidents that kind of
Yeah, there's...
validated the trooper presence?
Yeah, there has been an uptick in accidents. And look, I have always found that when you talk to people in a community, you can get a pretty good picture of what's going on. And there's clearly some erratic driving that is going on beyond the norm that we would expect to see. And this should not surprise us. Again, as I said, many of these drivers probably never drove in Haiti. If they did drive in Haiti, the norm and the expectation is fundamentally different than it is here. They don't have really familiarity with our laws. And so one of the things that we have worked very, very hard on, but we know we have a lot more to do, and the local community is too, is when someone takes the test, and what we're seeing is the failure of the failure rate is, I believe, about 16. There's about 17% of pass rate. That is a very, very low pass rate if you look at what we have normally throughout the state of Ohio. And so what we are seeing is people who are not familiar with driving, not familiar with English, and they're getting in the cars and they're failing the test time after time. But we have a situation in Ohio which is not just true, not just a problem for immigrants. I think it's a safety problem. We say that when someone is 18 years of age, they do not have to have any driver's education. And so what we're seeing from our BMV and what I'm told is you have someone who fails the test, and then they just keep coming back. And there's nothing to stop them from coming back day after day after day after day, and finally they pass the test. It doesn't mean they're a better driver. So, look, we're not blaming anybody, but we have some really serious concerns about driving. And, you know, again, this is why we have put a focus on driver's training. But we still have language problems, and we need to get more people in regard to the driver's training.
We've seen in the last week on social media stories about a woman in Canton eating a cat, a picture of a guy in Columbus carrying a dead goose or something like that. People are associating it with this problem in Springfield. Do you think that there's
It's one of the reasons. Look, I want.
misinformation? Do you think there's xenophobia that's informing this? Like, what do you make of all
Look, I'm not going to comment about that, but I think the governor of the state has an obligation to go before the people of the state and to outline what we are seeing every day and to explain what we're seeing. And that's what I wanted to do today, is to explain exactly what we are seeing. You know, the local officials have talked about, people who live in Springfield have talked about different things that might appear on the internet. A lot of things can appear on the internet. But they have talked about those, and they have said that they have not seen evidence of that. They're the ones who are in the community.
Does your experience in Haiti inform how you view this at all, or how does it concern?
I don't think it changes my attitude about what we're doing. You know, I guess I've not been in Haiti since 2019. Fran and I were last in Haiti in 2019. We've been there many times over the years. I guess some of my comments about the driving may be reflected in what I've seen in Haiti. You know, it's just a different norm, it's just different situation. I also know what's happened in regard to the health care. Fran and I spent a lot of time looking at the health care over the years as we have traveled to Haiti. You know, we work with our friend Father Tom Hagen, and what he has told us is that what's happened in the last several years is this violence has just, you know, got worse and worse, and that is many of the Haitian doctors have left. And so again, my comment about the healthcare situation today is worse than it was prior to the assassination is based upon what I'm hearing from people like Father Tom who are in Haiti. It's not what I've seen, but that's what they're telling me. Look, I think there are issues having to do with immigration are very legitimate issues. You know, I've traveled to the border, as you know, a number of years ago, but I was down there and saw the wall, saw the situation, commented at the time that we did not have a good border policy. I've not changed my mind. We don't have a good border policy. We need a good border policy. So, you know, there are legitimate issues out there that, you know, certainly candidates running for whatever office it is, any federal office, you know, anybody who's running for a federal office today or who's in a federal office who is not concerned about the border or won't talk about the border, I mean, you know, it's a natural thing to be talking about. So I would expect a United States Senator to be talking about the border, or I would expect it to come up, you know, in any discussion. Whoa, I can't do two. Look, I don't know anything about that. Yeah. Look, my job as the governor of the state is to do what I always try to do, and that is to come before the people of the state and to explain what we are seeing and what the best information we have is. And that's what I did today, and that's why I'm here today. We have been working on this for some time. It just seemed to me it was appropriate for the governor to come here today and to tell the people of the state of Ohio, this is what we are seeing. This is what we're doing. This is the problem we see with the federal government. This is what the community is doing, and they're doing a lot of good things. And so as we discuss this, we have to say the community has done a very, very good job dealing with a very difficult situation that was not of their making. And the Haitians who are here, if you talk to the officials and talk to people, they are also doing a good job. They're going to work. Some of them may not speak English. We may have problems in regard to the health care, but many of them are trying to get that health care, which from the point of view of the community, health care is important for an individual child. It's important for an individual. But when you have people coming out in such a large number from a country like Haiti where the health care is virtually non-existent, it can potentially, I say potentially, create problems inside the new community they go into, particularly in that large number. So it is very appropriate. Everyone look at this health issue as a matter affecting the entire community, and so that's how I approach it. We have talked to officials in both Lima and in Findlay. We are monitoring that closely, and we will, be there to assist them as well. Yes. Yes. Yes.
You referenced vaccines as part of the healthcare push. I've seen some claims about certain diseases kind of reemerging in Clark County. Have you guys seen any evidence?
I want to ask Dr. Vanderhoff to come up. He's been in direct contact with the health commissioner in the county and with others, and he'll tell you what he knows. And again, I think, as Doctor and I have talked about this, the actions we are taking are on the nature of prevention. We don't want to have a problem. We don't want to see something spiral out and then it's too late to do something. So these are preventive. I don't want to get anybody any kind of panic. It's just stating facts, and we need to stay on top of this, and that's what we're doing today.
Well, I think the governor has outlined very, very well the challenge that we're seeing from a healthcare point of view in the community. Primary care really is the foundation of a good healthcare delivery system, and we've seen that over and over again over time. So it's not surprising that when you have a community that has had a fairly abrupt and significant increase in population, particularly with an influx of individuals who've not benefited from primary care throughout much of their previous lives, that we're seeing demands on the healthcare system that are going to be best addressed by improving access to primary care for everyone in that community. And so I think that the governor's push for increased primary care support in that community is spot on. Now, what we are seeing is that these individuals are very interested in, very eager in accessing primary care, as well as vaccination. They are an under-vaccinated population. Nevertheless, as we look at vaccine-preventable illnesses, we in fact are not seeing a measurable, a discernible increase in vaccine-preventable illness at this time in the greater Clark County, Springfield community. But we want to be acting in a prudent manner to not leave that to chance. We want to get ahead of that issue and assure that we don't have a regrettable outbreak of preventable illnesses like whooping cough or pertussis, like measles. And we've seen those kinds of outbreaks happen all over the world, You can look at other developed parts of the world like Europe, where we've all heard about very significant outbreaks in illnesses like measles that can be prevented.
Well,
Have you met with any members of the Haitian community or engaged with them as you've been doing this stuff? The Haitian community in Springfield?
I have not personally, no.
Governor, kind of a two-part question. A, what is it about, through your research and investigation, about Springfield over these last few years, getting so many folks coming there? And has there been any thought of asking other cities, be it Cleveland, Columbus, bigger cities, to kind of help out, maybe to take on some of these folks? Has that been a part of the discussion?
Well, first of all, it is my understanding when these individuals come here, they indicate to an official on the border, close to the border, where they're from, and they basically at that point then are given some papers and they're free to go, and they're free to go anywhere. So there's no government program that says we're going to resettle so many people here, so many people there, so many people there. That's not what happens. So there is no really for the state. There's no legal way for us to divert people to another community. Now, you ask the question, why Springfield? And again, the people in Springfield, are probably in a better position to answer that. I suspect the mayor is, the county commissioners are. But after talking with them and talking with some business people, these people came here for a job. And whether there is a recruiting group that was recruiting them specifically, I don't know that. But as you know, what happens, and has happened throughout the history of this country, is you have a group from a country, immigrants from a country, and some will start going somewhere and finding jobs, and then they will tell their other family members or other people that they know, hey, there are jobs available in a certain place. Springfield, the good news is Springfield has made, a significant resurgence. This was a community that, historically was a great manufacturing city. They had some downturns, but, 10 years ago or so, 15, they started seeing significant upticks in companies coming in. Those companies employ people. Those companies needed to find employees, and those two things came together. The Haitians came together with the employers who needed to find them. But I think the other part, as I said, every immigrant group in this country has done that, has followed other people who have gone from the same country to a region where they can find a job. And each one of us has that in our history if we go back far enough. No, and that's why our actions have started months and months ago. But it occurred to me as this discussion continues that we maybe have not done a good enough job communicating to people what we are doing as a state. So we have done a lot of different things. We continue to monitor the situation. As we continue to look at it, we will continue to come up with things to do where we think we can make a difference. And the two things I'm announcing today are things that we know that we can do. As far as the surge with the highway patrol, that came after discussions with the chief of police. So there's a real concern in the community about traffic. The primary care isn't just an ongoing crisis where the system is simply overloaded, which means it's overloaded for everybody. And look, what we want to really encourage the Haitians to seek out primary care. But when they do that, we also know that other residents who have been there, sometimes have to wait a long time and are discouraged from primary care. So it's an untenable, it's not a good situation. So, the fact that this has been such a big surge calls out, I think, for our continued monitoring of this and for our continuing action. Also calls out for the federal government to do something. No, I think officials there would probably be in a better position. I get the impression that this is starting to level off, but again, they're better able to tell you that. And again, the other thing is no one knows the total numbers. So. Well, I think, first of all, as they started seeing these numbers, they should have had a plan as far as settlement. They should have had a plan, at least, if not that, at least a plan in regard to what assistance they give local communities. Federal government is, as you know, is solely responsible, and they've asserted that right many times in regard to how they deal with the border and how they deal with immigration. Court cases are pretty clear. So as these numbers dramatically pick up, there is some obligation on the federal government to help local communities who had nothing to do with the decision about people coming in, but now find themselves with a massive number of people. I think communities always welcome growth, or almost always, not all, but usually they welcome growth. But what we have seen, if you just look at the percentage, this is a massive increase. It's just unprecedented what we've seen in Springfield. And so, again, they need help. That's pretty much it. I mean, the federal government needs to be of monetary assistance. I don't know. I didn't see it. I don't know what his statement was. So, look, I'm here as the governor. I'm going to outline what I see and what I think we should do. Anybody else? Okay. Thanks, everybody. All right, Colonel.